IVF baby is as healthy as the one who's.
Yes.
We tend to blame the female more, in terms of infertility and everything. The blame game is always on them.
Yes.
So, what is the ratio?
40% of the couples who are infertile, there's a male cause. 40% there's a female cause. So they both are equal.
Equal, yeah.
And 20% is unexplained.
Nightlife also have an impact on infertility.
It does. Sleep is very important for fertility.
What are the success rates of IVF?
Nothing beyond 40%.
How is the reaction when they tend to deliver through IVF?
First thing when you deliver that baby and show the mother, there are tears. Yeah.
So, are there any specific lifestyle changes you would recommend people?
There are many factors. Weight being a big factor. Mediterranean food is good for fertility.
Is IVF a very expensive procedure?
On an average, between 1.5 to 2 lakhs.
Hi, Dr. Anand.
Hi, Aman.
Thank you so much for coming. I'm really happy that you are here today.
Thank you for having me.
My first question to you is that what inspired you to, study gynecology and infertility and do whatever you are doing right now?
To begin with, I have been raised in a family full of doctors, and my father is a gynecologist. My older sister, who's 6 years older to me, is a gynecologist. So, whenever I used to come from school or college or after playing something, the talk around the dinner table or in the living room would always be, oh, I've done this case today. I've delivered this baby. It was such a difficult delivery. We saved the mother. We saved the baby. We used to receive sweets and flowers and, gifts. And it was a very joyous moment. And I would see the smile on my parents' face and, my sister's face. And I would be, wow, this is something nice. And to begin with, I was always in school and in college, I always wanted to do something in biology. So medicine was wohi karna tha. That was it. There's nothing else. In that also, I got a good rank, got into, one of the best colleges, that is Sion Hospital. And in that internship period, we had a 2-month posting in gynecology. And that's where we had, we used to attend emergencies. We have seen around 40-50 deliveries in one day.
Wow.
And it was exhilarating. And it was really, that's when I decided that I want to do this. And I pursued it. And I got into training for gynecology. I did my DNB from Somaya Hospital. And then I went to UK because I wanted to study further. I worked there for 4 years. I got the MRCOG UK degree. And then that's where I was exposed into infertility and IVF. And when I got exposed into the IVF and infertility part, that's it. The story changed. The moment I saw the egg and the sperm at a microscopic level, and we could literally see life evolving from an embryo point of view. That's the first stage of life. That it's marvelous, and that's it. And the rest was history. And I said, that's it. I want to do this. I applied for a infertility fellowship. I got it. I was trained for a year by a very good mentor. And then I decided to come back. And I thought that whatever I've gained there, I want to come back and, give it to my society or give it, whatever you learned, you use it for your own people. So and that's why I've got into this field, and we have our own IVF lab in Lokhandwala, and we cater to everyone.
So, what is the name of your lab?
It's Create IVF and Fertility Center.
Okay.
Yeah.
So, now you told me that when you were practicing or learning this, you used to see 40 to 50 deliveries in a
during
day.
my internship. Yes.
Yeah, during your internship.
Yeah.
So, how was it? Like, mentally, how was it?
So it was, to be honest, first few days were draining. It was intimidating also, because there was just no time to rest. We were, there were 4 seniors above me, and me being the junior most, an intern. So all we had to do is just run around as an intern, collect blood, because we couldn't perform any surgeries back then. But then as 1 month went by, I started enjoying. And I used to go even when it was not my emergency days, because I wanted to learn. And my senior saw, that I was sincere. So then they started giving me small, procedures like stitching, what we call as episiotomy, and that is a cut that we give so that the baby delivers easily. So that's then I got very interested. That when I'm getting something and I'm getting to learn a lot, but it was draining. It's hectic for the doctors as well. It's tough for the patients as well. And given that our population is so much, even the institute, there's a lot of burden on the healthcare staff and logistics. So, but otherwise, it was a great experience. Yeah.
But sir, during your internship, so when there used to be, I'm sure there used to be out of 40, 50, there must be some complicated cases as well.
Yes, a lot.
So how you used to deal with that mentally?
So one is that you get used to it. So initially, it is scary. Because I remember there was a case where the patient lost almost 2 liters of blood. Baby was fine, luckily. But she had to be resuscitated. So that was scary. That's when I realized that in this journey where, it's a joyous one, imagine the relatives outside are waiting for the good news. Oh, baby's come, mother's going to come. And you you give them the baby, but you may have to sometimes, break the news that what, the mother is right now serious, and if we don't act fast, we may lose her. So it's within minutes that you have to act. So it was very intimidating. It was a bit scary, but when your adrenaline kicks in, you just do your best. And obviously, being in a big hospital, you have seniors around, you have the consultants. I also learned when to call for help. That I was observing my seniors that you can't do everything on your own. It's not possible. So you have to kind of see which are the serious cases, which you can manage, which you can't, and then which you can't call for help, because it's not an ego thing. You have to save that patient's life. So you need to know when to call for additional help. So it's humbling also sometimes that, you have to stay humble. You need to keep the patient at you have to give priority to the patient and patient's health.
So tell me this, that good or bad, whatever be the event, does it stay back in doctor's memory?
Yes, it does. It does. In fact, the bad events stay a bit longer because we are also humans.
Right.
See, an event has to basically it should teach you something. If it doesn't stay back and if you don't learn from it, then you're not a good you're not a good learner. You won't become a good doctor. Complications happen with everyone, with every doctor, and it can be traumatizing for that event. But you have to move on. But of course, change a few things. You have to constantly think that what should we do next time so that this doesn't take place again. And that's how you evolve. So they do stay back. And there have been cases where we still remember some of the cases. It's imprinted in our brains, even good ones. Obviously, good ones are imprinted even more. A difficult case where we save the baby, we save the mother in the nick of time. So that's even more heartening. But even the bad ones teach a lot. So yeah.
So sir, what are some common problems which are there in men and women both in terms of infertility? In India specifically, if you have seen.
So
or does it differ from country or region or place to place?
So to be honest, it does differ. It does differ. But nowadays, with the way the world is going, and India is also, it's getting influenced by the Western world culture, a lot. So there's not much difference now.
Okay.
The most common factors that are influencing fertility nowadays, and this is we are following the trend in the West, is obviously late age of marriage, obviously late marriage that are taking place. People are planning families a little late. So as we age, the fertility potential goes down, both in males and females, more in females. Okay. So age is a big determining factor.
So ideally, sir, what is the age group that is
Yeah.
suitable for a female to.
Studies show
Yeah.
that the best reproductive potential in a woman is between the age of 22 to 26.
Okay.
That those 4 to 5 years.
Hmm.
That's the best age group because they are young, they're at their they are healthiest at that time, and the ovarian reserve is at its peak. And as they grow older, the ovarian reserve keeps going down. But what I meant by ovarian reserve is basically the number of eggs in the ovary.
Okay.
So as we say that the biological clock is ticking, it starts ticking, and then there's a rate of decline which depends on many other factors also. So there are other factors like lifestyle is playing a big role. So we've seen youngsters nowadays, smoking, excessive drinking, excessive caffeine, bad diet, lot of trans fats in the diet, oily food, sugars, carbohydrates, simple carbohydrates. This is all hampering, their own health and even fertility in general.
Even caffeine affects fertility?
Yes, so excess of caffeine does affect. So studies show that you just a 1 cup of coffee in a day is good. So it should be in a day you should not consume more than 200 milligrams of caffeine. It was a very interesting study done abroad, and it compared the Indian and the subcontinent women and the ovarian reserve. It basically the Indian women and subcontinent women, their ovaries age faster compared to Caucasian women, and almost by about 5 to 6 years. So probably it's maybe because of genetics that are there, or also environmental factors like pollution, air pollution, quality of air, quality of the water or we drink. Another recent study, very important study, was effect of plastics, and microplastics were found in semen, and it was affecting male sperms also. So this is a very interesting study that's why a lot of plastic should be avoided. We should. That's why they say that don't consume water, prefer glass bottles over plastics.
Right.
And there's been microplastics found in the bloodstream also, and that can also be affecting fertility. So consumption of plastic may be more here because obviously it's durable, it's easy to use. So that awareness has to be there of small things.
So plastic is also like, how does plastic get into the bloodline?
So
like, what are the ways?
Yeah, so most common is the water is in the bottle. The bottle is made of plastic. Plastic is made, the main component is what we call as BPA. Okay. And that goes at a molecular level, it gets into the water. You're drinking the water, and then it enters, it gets absorbed into the bloodstream, and with the blood it goes to all the various organs. And one of the organs are in the male the testes, and in the female the ovaries. Probably that is also responsible for aging and affecting the sperm and the egg quality. Yeah.
So now if supposing if there's a couple, and if they're having some issue, so when is the time that they should realize that it's time for them to go and see a doctor regarding infertility, or it's time that they should get themselves checked?
So if a couple, if both the partners are less than 35 years of age, and they've been trying for a year with regular unprotected intercourse and they've not got pregnant, that's when they should start going to a fertility specialist. And if they're above 35, then if they've been trying for 6 months and not got pregnant, then they should visit a fertility specialist. They should not wait longer. At least start investigating that what is happening. So that's the time where we tell the couples that you start now visiting a specialist and get yourself evaluated.
But sir, in India, I've seen that there are a lot of people very hesitant, to talk about this. They are not very comfortable. They don't even discuss it with their family and friends. They keep it so personal. So even when they come to you, that boundary is always there, that you have to break that wall to make them comfortable and talk about it.
that boundary is always there. So it's the onus is on the doctor to make them feel comfortable and tell them that this is the safe space. So, as a rule, I only call the couple inside my room. No in-laws, no brothers, no sisters, no friends allowed.
Right.
Okay, and the wife and the husband, they are alone in the room, because that's when they are at their most, they're the most comfortable.
Comfortable, right.
It's such a personal space. There are so many details that you wouldn't want your mother-in-law to know, or father-in-law to know, or father or mother,
Right.
So that's the rule number one. Now, it's somewhat still a taboo to talk about fertility or infertility, if you say, because what happens is that there's always a comparison by the previous generation. We had kids early, we got pregnant so soon, why aren't you all getting pregnant, kuch to gadbad hai, this, and in-laws blaming the daughter, the mother-in-law blaming the daughter-in-law, and vice versa also.
Right.
So there's a lot of pressure, because India socially is also so complex, because we are living in, majority of the people live in joint family, where there are two generations. So there's always that direct comparison. So it puts a little bit of shame there is a little bit of that shame that goes on, and because of that they don't open up, the couple doesn't open up. So that when you come to a doctor's room, you have to tell them that, you have to give them that comfort, you give them the confidence that this is a safe space, this is all confidential, that whatever you're going to tell is, everything is confidential, and open up, because that is important for us also to know every detail. So you just what I do is I tell them to, you start with your story. It's not like a monologue that, okay, history liya. When you tell them, okay, can you tell me something about yourself, and when they start talking, I've seen that they open up.
Right.
So you give them the floor and just be a good listener.
But what would you advise people? They should discuss these things openly and come out and talk about it. It will just make things better for them.
Absolutely. It makes things better for them. It makes things better for others, because talking helps. It's like therapy.
Right.
So I think and slowly I think that is happening now. Okay, because of social media, because of a lot of awareness. And obviously the celebrities also, a lot of them going through this fertility, and them being vocal, it actually helps that create awareness that this is normal. It's not abnormal, and it's a miracle. In fact, you just need a little bit of help to get your dreams of getting a child or children. So talking definitely helps, and support groups help, talking to others who are going through this, because then you also feel that you're not alone. You will realize that, oh, you know what, I'm not alone. There are so many people who are going through this, and it's natural to feel anxious, it's natural to feel depressed, when things are not working your way. So it really helps.
What are the most common treatments available for infertility today?
To begin with, the basic treatment, so when a couple comes who are struggling to conceive, we do some basic, we obviously take a detailed history, we examine them, and we do basic investigations. And basic investigations include some blood work for the woman, blood work for the males also, and we test the ovarian reserve for the woman, and we do a basic semen analysis for the husband. If everything is fine, and we feel that most of the couples don't know when their fertile window is. So what is fertile window? It's when the woman ovulates. When she ovulates, the egg only remains alive up to 24 to 36 hours. That's how short the window is, and most couples don't know when it lies. So the most basic form of treatment we offer is something called as follicular tracking, where we can tell them that from the 7th or 8th day of their cycle, we can start doing sonographies, and we check how big the egg is growing. And when the egg is about to ovulate, okay, so if I go more technically, we check something called as follicle. Follicle is like a balloon-like structure where the egg is it harbors the egg. Okay, so when that follicle is big enough, mature enough, where we feel that now it's going to break and you're going to ovulate, we tell them these are the good days. So we narrow the fertile period for them, so it's easier for them to to concentrate on those days only.
Right.
So that's the most basic form. If 2 to 3 cycles have gone by, 2 to 3 months have gone by with this treatment and it has not worked, then we go to the next step. Sometimes we have to do what we call as intrauterine insemination. What happens is the same way you track the ovulation. When you can see when the egg is ovulate, when the woman has ovulated, instead of asking them to keep relations naturally, you ask the husband to give his semen sample in the lab, and we wash the semen sample. We remove the dead sperms, the unhealthy sperms, and we choose only like the top layer of the sperms which is there, which are the best swimmers. We take a very small volume in a small tube, we directly insert it in the uterus. So the sperms don't have to travel a very long distance. So there are more sperms that are available to just cross the tube and meet the egg. Right. So the success rates are slightly higher. It's not 100%, right, but it gives us slightly higher success rates. This is a very good technique used for patients with sexual disorders also, where many people have severe what we call as vaginismus, where they can't have penetrative sexual intercourse, with erection problems, ejaculation problems. So it helps these couples. It also helps couples with unexplained infertility. So PCOD is one of the other conditions where IUI or intrauterine insemination may help. We can offer this for up to 2 to 3 cycles. If that doesn't work, then you need to counsel them for IVF.
Okay.
So that's the more advanced form of treatment.
And so what happens in IVF?
So IVF is basically in a month. Okay, so you have 2 ovaries. The woman has 2 ovaries, and in those ovaries there are small follicles, as I said, and it's these follicles that harbor an egg. One follicle has 1 egg. Normally, if you just let the cycle go naturally, only 1 of the eggs get released, and if there is no pregnancy, that follicle dies, and the rest of the follicles which didn't grow with the egg, they also die.
Okay.
And then the next month, the new set of follicles or new set of eggs come. In IVF, we try to make as many eggs grow. Okay, so we basically call them on the 2nd or 3rd day of their period. We do a sonography to make sure that everything is normal, all the follicles are small in size, and then we start giving them hormones. These hormones are given at a higher dose so that we want as many eggs to grow. And when they are all mature, we retrieve these eggs outside. That is done under anesthesia. It's called egg collection.
Okay.
So we go with we do a vaginal scan, and there is a long needle that goes. It punctures the ovary and punctures this follicle, and we suck out the fluid where the egg is, and we just bring all the eggs outside and we send it to our embryology lab. And that's the time when after a couple of hours, we come to know how many eggs are actually mature, which eggs are good looking, which are not so healthy. On that day again, we ask the husband to give his sample outside. We wash his semen, and select the best sperm. So there are 2 types. Now conventional IVF is where you keep the eggs, get the semen sample and mix the egg and the sperm, and the sperm still have to naturally try and fertilize the egg. Nowadays what we do here, most of the labs in India, we do something called as ICSI, which is intracytoplasmic injection of sperm. So we individually select the best sperm, we magnify it 40 times so that we can actually see which is the best swimming sperm, best looking sperm. We slash the tail so that it stops swimming, take it inside the needle, and we physically insert it inside the egg. So that is done in the lab. And once the egg and the sperm meet, then what is formed is called as the embryo. And this embryo is grown in an instrument called the incubator. Basically, it mimics the uterine environment or the environment of the uterus. Okay. There are certain gases, the humidity that is similar to the uterus so that the embryo grows. Usually we grow the embryo till the 5th day stage, and at that stage, if at the same time on that day when the embryo is grown, if the woman's uterine lining is good, her hormone levels are good, we call her back and we take 1 or 2 embryos. That is a whole separate discussion how many to insert. And with a small tube we insert under ultrasound guidance, and we see exactly where we have to place the embryo very carefully. That's a procedure called embryo transfer. We do the procedure called embryo transfer, where we insert the embryo in the middle of the right place. It's called the implantation point. We insert it in the uterus, and then we have to support the pregnancy with hormones for another 14 days. And after the 14 days, we ask them to do a pregnancy test to see whether they've conceived or not.
And that entire procedure is otherwise the same. Like once if someone conceives through IVF, if a female gets pregnant, then it has to be it's a 9-month journey.
It's just the same, except that the first 3 months you are taking certain hormones to support the pregnancy, because it's not they have not ovulated naturally, so the natural hormones are not released, so you have to externally give them the hormones for the first at least 10 to 11 weeks. Then you can stop, and then it's routine from there, just like a normal pregnancy. There's no difference.
No. And the IVF baby is as healthy as the one who's...
Yes, so that's the biggest misconception what people have.
You
know, when they hear about IVF, नहीं बच्चा बराबर नहीं होगा ना, हमने सुना है. It's a myth, because had this been true, why would medicine? Why would we tell people to do IVF? Otherwise IVF would not have come in. Because if we are producing abnormal babies, then that's not a good procedure. So that's a myth, because you can't change. There is no difference in a normally conceived baby and an IVF baby. Okay. IVF pregnancy as a whole, yes, it has to be monitored carefully, because the mother is at a slightly higher risk of getting raised blood pressure in pregnancy, slightly higher risk of having diabetes in pregnancy. Sometimes early deliveries may take place, but structurally the baby or genetic conditions does not change. Okay, because it's basically the genes that are responsible for any structural abnormalities or any abnormalities in the baby, and we are not manipulating the genes here. So that is a misconception. Yeah.
And so now there's this thing in our society. We tend to blame the female more. In terms of infertility and everything, the blame game is always on them.
Yes.
So what is the ratio between a men and women? Is it same, or sometimes the men are men? I feel men would be more, but they would never accept it.
Yeah. So see, we do live in a patriarchal society. Let's face it. It's honest. It's there in all stratas, lower, middle, upper also. And that male ego does come in. That मुझ में तो कुछ problem नहीं है. But if you look at fertility, the causes, it is an equal distribution. So 40% of the couples who are infertile, there's a male cause. 40% there's a female cause. So they both are equal. And 20% is unexplained, where everything will be normal and still somehow people are not conceiving. Because there are so many things that are involved, and that's a whole separate topic. But they contribute equally to the burden of infertility.
So you think this problem of infertility is more, it's a more city-based problem? Like people living, in villages or something, they tend to not have all these problems?
Yeah. So again, it is more common in the urban areas, because see, with development and with urbanization comes some, like there's pros and cons in both. And the negative aspect is, as I said, that you're working, the environment is stressful. By the time you're settling, you're ready for marriage, the age is advanced. Then again, even after marriage, not everyone is just ready to have a baby.
Immediately.
So the time, by the time they are ready for a baby, it's probably too late. In rural areas, because obviously it's rural, they are still probably a bit more I shouldn't be saying old time, but they are thinking that, okay, let's get married first. They have early marriages. They, even if they get married, they want to have babies sooner. So it's a little less rampant there. Also lifestyle, as I said, smoking, drinking, excess alcohol, all of this, pollution, exposure. I mean, the rural areas are obviously cleaner with cleaner air. So that also impacts fertility. So yes, there is a slight difference.
Does nightlife also have an impact on infertility?
It does. Sleep is very important for fertility. So if you don't have a good sleep, there's a hormone called melatonin that is released, and melatonin basically gives you good sleep, makes you calm, makes you relaxed, and it helps in these reproductive hormones also function normally. If your sleep is disturbed, your if you, let's say, you come late and then you have to wake up early, barely 3 to 4 hours of sleep, your body is running high on adrenaline, cortisol. These are fight and flight hormones. So these hormones hamper the reproductive hormones. So it is counterproductive. So sleep is very important. A 7 to 8 hours sleep is essential for fertility also.
So what are the success rates of IVF?
Right. So when you say success rates, what does it mean? Does it mean that it's just a positive pregnancy test? Okay, so that 2 lines on the pregnancy test, is that success rate? Or a live birth, that in the end, at the end of 9 months, the couple has a healthy baby in their hand.
No, like towards the, having a healthy baby. Yeah.
Correct. Yeah. So when you talk about live success rate, we talk about live birth rate. And normally that is nothing beyond 40%. 40 to 45% max. Positive pregnancy rate will be more. But not all of the pregnancies reach 9 months. Sometimes some people have miscarriages, early miscarriages. So when you talk about live birth rate, it's 40%. That's the global average.
But so, in terms of your profession, a patient, I don't know if I should be calling them a patient or not, but, they tend to be, mentally also very disturbed.
Yeah.
So how do you manage, both the aspects? One, treating them physically and also looking after their mental health. How does that work?
Yeah. So it's very important to address the mental aspect. And as a doctor, you have to be intuitive also. You have to look at the body language. You have to see how they're talking. You have to be intuitive. 80% of the infertile couple, or I would say even 90%, have, a lot of psychological they are basically stressed out.
Right.
So you have to address that. So the first thing is that you give them time. When they come to a clinic, don't treat them as a patient. Don't treat them as a file. Just don't spend 5 minutes. Spend a good half an hour to 1 hour. Take a detailed history. Let them talk. And then tell them ask them about, how are you, sometimes they have gone through IVF failures. So ask them that, how are you feeling? Like, what are your thoughts right now? When you ask them, they only feel good, that, right now, and most of them open up. And it's very important to have them, give them that emotional support through a psychologist. So we have a psychologist who works with us.
Okay.
She herself, she has been trained in the UK. She was living in the UK for a long time. And she herself went through fertility treatment. And at the end of the fertility treatment, she decided that, what experience she had, she wanted to help others. Because what she was doing was, she took her psychology background and incorporated into what she was going through.
Right.
And she was like, I think we need to help people more on the psychological aspects. So we came up with these workshops. We have come up with these workshops that before IVF, these patients, they go through these workshops, which is like a readiness workshop, where our psychologist takes them through her journey and, tells them a more realistic picture that, these are the side effects that can happen and how to cope with them mentally, And we also have a nutritionist who talks about the diet aspect.
Right.
What diet, what foods to have to keep your mind calm, to keep your body healthy also.
Right.
And there are certain exercises which, like meditation, there's visualization, all of that, which they teach these patients, so that they are more armored and they're stronger when they go through the cycle. So it's very important to touch up on the psychological aspect. We also have the psychological readiness sheet, where we can diagnose that, okay, this patient is probably not ready right now, so don't rush into IVF. Obviously, we have to see medically also.
Right.
If we don't have time, then sometimes we have to rush, but we have to take the mental aspect into account, and it's very important. So a healthy body and a healthy mind, there's a higher chance of success rate. If someone is not ready mentally, success rates go down. It does affect the
Right.
success rates also.
Is there a particular age group for doing IVF as well? Like after a certain age, you can't even do that.
Yeah, so the new there's a law that has come in India.
Okay.
The ART law in 2021 says that above the age of 50,
Okay.
you can't, for the woman, and above the
Okay.
age of 55 for the males,
For the
you
males.
can't offer IVF. And
Okay.
I think it's fair enough, because it hampers. There are risks involved when you're
Okay.
giving hormones. Okay, there are certain risks that are involved. Obviously, at that age, the embryos that are formed, the babies that are formed, are also, there's a higher chance of them having abnormalities.
Right.
So you have to be practical, and I think that's the cutoff, and it's a very logical cutoff to have.
So, sir, now if I've had a IVF failure once or probably twice, can I opt for it again, or like how does it work? Does it work only once, or like how is it?
No, so it depends from case to case. So
Okay.
when it fails, that time we have to understand, we have to try to see what was the reason for the failure. So we think of 3 levels where it fails. The first level is at the embryo itself. Okay, so embryo is a product of the egg and the sperm. So most common cause of failure is that the embryo itself was not healthy. Okay, when I say healthy, embryo looks, there is a morphological classification we follow where we see how good the embryo looks, but it's not only how it looks, but each cell of the embryo should have equal genetic distribution from the male and the female. If there is any distribution, when the distribution is not done properly or not happened properly, then that embryo will not, it's a what we call as an abnormal embryo, genetically abnormal embryo. Nature only will not let it implant.
Okay.
It's like protective.
Okay.
So we have to study that, is the embryos good, were the embryos good, should we test? So one IVF failure is done, recommend that testing of the embryos. We can even test the embryos now next time when they come, that so that we would come to know that how many are normal and how many are abnormal genetically.
Right.
And those which are abnormal, we don't implant, only the normal ones are taken. So failure can take place at the embryo level. Failure can take place at the uterus level also, because it's the uterus that harbors the embryo. So is there any issue in the lining of the uterus physically? So we do, obviously we have advanced scans, 3D scans, MRIs. Even better would be actually going in with a camera inside the uterus to see whether are there any abnormalities in the uterus. Sometimes there's a fibroid, sometimes there's a growth called as a polyp which is lying there, which prevents implantation. Sometimes there is scar tissue because of certain previous procedures.
Okay.
People who have had previous miscarriages or have terminated pregnancies, there is a procedure we do, is what is called a DNC, where we clean the pregnancy out, and that can cause scar tissue. Or is there very rarely there's a curtain in the uterus called a septum, and which may not be seen on the scan. So that can be diagnosed with what we call as hysteroscopy. We go in and see the uterus and the lining physically. And at a molecular level also, there are certain tests. The validity of these tests are a bit debatable. That, is the receptivity of the uterus, is it receptive when we are implanting the embryo, or should we give hormones for more days and then implant? But this test is right now debatable and it's contentious. So I will not go into that. Third level is an immunological level, that maybe, okay, embryo is good, uterus is fine, the embryo is healthy, uterus is healthy, still it's not implanting. So is the human body rejecting the embryo? We have antibodies.
Yeah.
It's a natural mechanism that any foreign object
they tend to reject.
Reject. So is that happening? Are these inflammatory cells in higher numbers? That at the uterine lining, that when the embryo is trying to implant, the body is saying that no, this is foreign, this will be harmful, and rejecting it. So that's the immunological factor. So there are many factors, but so you have to go in detail. But that doesn't mean, so we've had patients with 3-4 IVF failures and then have also conceived the 5th time. Okay. But you have to see where lies the fault. Right. And you have to come up to a diagnosis. So if the embryos are just abnormal, then, and if the eggs are very few, then we know that probably it's the egg at fault. Or if the sperms are not healthy, then it's the sperms at fault. Even at which stage the embryo is getting arrested gives you an idea that it's probably the sperm factor or it's the egg factor. That also you can come to know. Right. So you have to go into detail, but you have to reassure the patient that you don't give up. Don't give up. Just because you had 1 or 2, many times that's some, people think IVF भी fail हुआ, अभी तो और कुछ है ही नहीं, मतलब nothing is there. यही सोचेंगे कि अभी कुछ भी नहीं है. Now my world is, it has crashed. Yeah. So many times we've seen patients with IVF failures when they take a break. In fact, just in the last 3 months, 2 of my patients who one of them had 2 IVFs failed, one of them had 1 IVF failed. We told them to just take a break. They said, yeah, you know what, we're tired. Went for a vacation, they conceived naturally. After 8 and 10 years of infertility. So that break is also important. You have to tell the patients to take a break also. We don't know why. So it's because, your body resets. When you don't have too much of hope and, when you don't have too much to think about or look forward to, you just go naturally. And you conceive naturally. Right. Many times we have seen that. So, sir, how is the reaction when they tend to deliver through IVF? Yeah. What is what is that feeling, and for you and the patient as well? Yeah. And how is their reaction towards you? It's something that I can't describe, honestly. Because you can see the emotions pouring out. Right. The first thing when you deliver that baby and show the mother, there are tears. Right. Because they know what they've gone through, and when they realize that their dream has come true and they've got their own child, there are tears, and sometimes even we have tears. When I'll tell you about a case. It's very dear to me. We'll talk about it. Yeah. So it's just a very happy feeling. There's a relief, and somehow it makes you humble also. That it just. Sometimes we do everything. Science, sab kuch, scientifically we've gone so far. But still there is something, where it's on destiny and there is some force which is higher than us, and you just do your job. You do your best and you deliver the best healthcare, and then let things go. Sometimes you have to let things go. Yeah. So there's relief, there is, there's obviously happiness. We also feel proud at sometimes, and that, we've achieved something. Yeah. But that pride should not go too much in your brain also, Yeah. And especially when, for me, like when you've seen the child as an embryo, as I said, that's the first form of life. Like I've seen, and then I've implanted that embryo. I've seen the baby grow in the scan, and then delivering the baby. It's like a full life cycle. Yeah. So what I do is then I take a picture of the embryo, take a picture of the child, and send it to the mother. And they can keep it as a bookmark.
The entire journey.
That entire journey. That this was the embryo, and now look at the baby.
Right.
Yeah.
Right. So
it's very heartening.
Now, if someone is delivered through IVF, so do they need to keep consulting you throughout their life, or like is it like once it's done, it's done?
Maybe you're asking that is there any long-term consequences of IVF that they need to follow up?
Yeah, like my question is that only,
Yeah.
that do they need to, like,
Yeah.
is there a void to, that they have to come to you?
No, there's nothing, because as I told you, after the 3 months in pregnancy, everything is normal, just like a normal pregnancy. So you don't, there's nothing, there's no need to come back unless they want to utilize the other embryos and try for a second child.
Okay.
Otherwise, their life is the same. There are no known long-term consequences of this treatment.
Okay.
If I was to put it that way, that that's another misconception, that इससे change हो जाता है body.
Yeah.
There is a chance of cancers that can happen, and there are a few case reports. Case report means 1 in a million or 2 in a million cases that multiple IVF cycles done and then ovaries में cancer हो गया है. But it's so small to say that, to say it confidently, or it's not significant enough for us to say that yes, IVF is one of the factors for ovarian cancer. But when 2-3 IVF failures take place, that's when we tell the patients also that do we have other options, and sometimes you need to have closure also.
Yeah.
Okay, but the other options are, if the eggs are not healthy, then sometimes we use donor eggs with someone else's egg. We match the profile to the patient, match the blood group we use, and the donor who's donating the egg is from a healthy younger age group, ideally between the age of 23 to 33, with a good ovarian reserve. So we can opt for that if the patient's eggs are not there. And if usually that has a higher success rate. But sometimes if that also doesn't work, then by the time that happens, patients and the couples themselves, most of them close the chapter.
They tend to realize
that that's enough, because life is not only about fertility and having children.
Yeah.
There's so much more.
Yeah.
So sometimes they get closure by after doing this treatment also.
So how many kids have like a female had like through IVF?
So nowadays, as you know that you mean in one pregnancy, or
not in one, like
how many?
Yeah.
So
in total, like how many babies have they?
See, nowadays the present generation is not opting. Most of them don't opt for more than 2 children.
Right.
Because of the scenario, the financial conditions, obviously inflation going on.
Yeah.
So max I've seen is 2. I have not seen anyone coming for a third. Most people opt for 1, and sometimes they opt for inserting 2 embryos. Sometimes we insert 2 embryos, and that's again a separate topic. If the embryos are not looking very healthy, if they are old, the patient themselves are old, then we say that implant 2, so that in less number of attempts you're giving them a chance of a live birth. But if both implants, then they have twins. If they get, in fact, just this week we delivered 2 twins. Wow. So through IVF, so then they are done. They're not going to come for more. So usually it's 2. Yeah, but there's no limit. I mean, that's up to the patient and how many embryos we have stored.
Right.
Yeah.
So are there any specific lifestyle changes you would recommend people for them to not, go towards infertility or?
Yeah, a lot. So there are many factors. So weight being a big factor in both the females and the males. So ideally the BMI, which is the weight to height ratio, it should be between 19 to 24.9 or 25. Above BMI of 25, it impacts.
This is for everyone?
Everyone.
Okay.
Everyone. More so females, but even males. So more weight. In fact, in the UK, the government funds IVF cycles. Did you know that? The government funds IVF cycle because they want people.
They want,
It's the population is declining. So, but it doesn't fund those couples where the BMI is above 30, because they know the chances of complications are more. Okay. See, hormones also have some side effects.
Right.
Okay, and I'll come to one of the cases that we just came across recently. And also the failure rates are higher. So it's an incentive for the patients to lose weight. So weight, Okay, so overweight, especially fat around the belly area, studies have shown they release a lot of reactive oxygen species that affect the egg quality. So losing weight, a healthy diet, avoiding trans fats, avoiding processed foods, avoiding sugars, carbohydrates, habits like smoking is a big no. Alcohol, nice, which is nice UK. There's a national guidelines in the UK. They say that in a week some amount of alcohol can be consumed. We still say that try and avoid alcohol for the woman.
Right.
Okay. A sedentary lifestyle is also counterproductive. So you should not be, many people are just working in the office 8 hours, 9 hours of sitting. So in fact, when people are going through IVF treatment, another misconception is डॉक्टर IVF करेंगे तो प्रेगनेंसी में तो आप हमको लेटना ही पड़ेगा ना फुल 9 months we just have to do nothing, we have to just be and we have to have complete bed rest. That's a misconception. In fact, that is counterproductive. That because these hormones have a tendency to thicken the blood, sometimes blood clots in the legs and the lungs. So don't have a sedentary lifestyle, especially when you are going through the IVF treatment. You can go on with your day-to-day lifestyle. In fact, that is good so that the blood circulates. You're not at a risk of blood getting stagnated and getting clotted, because that can be dangerous. So these are all the lifestyle factors that that we advise. So it's a balanced diet.
So is there any specific superfood they should opt for?
So there are a few Western studies. There was one study from Monash in Australia that suggested that Mediterranean food is good for fertility. So legumes, legumes. They have a lot of legumes, extra virgin olive oil, olives, green leafy vegetables, and fish, especially salmon and tuna also. They have omega fatty acids. They have said that these foods have anti-inflammatory properties, and inflammation is one big factor which hampers implantation of the embryo. So these foods have naturally anti-inflammatory, and they have antioxidants also. So that does help in maintaining the quality of the eggs and the sperms, and also probably helping in implantation.
That's one of my favorite cuisines, to be honest.
Yeah,
so
good.
I'm very happy hearing that.
You're on the right track.
I'm on the right track. So, are there any, resources and support groups for people who are going through some things like that, probably before coming to you, they can connect with them, open up about their things, and then probably come to you and get themselves.
Talking about support groups, there are a few support groups that are there in India. One is Fertility Dost, one is Sifar. These are a few fertility support groups that I came to know with the help of my psychologist. And it was heartening to see that these are good forums that people can go to speak to others on an online platform. And it really helps, and even social media itself. There are so many things on Instagram. If you go, there's like fertility journey, fertility, IVF, and there are even on Instagram, people are talking about their experiences. So talking helps, okay, and I think we need to break away from this stigma that this is not natural, this is not normal, because this is all normal. It's just aided by science, and it doesn't make the baby different, it doesn't make you different. So and they have it gives a lot of hope to everyone. So
and these groups also must be removing those misconceptions people have
a lot
about
of misconception,
because it's still something very new for people in India.
Yes,
right?
it is.
So what advice would you give to the couples who are starting their planning to start their parenthood journey? So what advice would you like to give them?
So first is that I tell them that don't put undue stress on yourself. That's the first thing. The second important thing I say is that don't compare yourself to others, because the first thing why most of the patients and the couples, why are they so stressed, why are they so depressed? Because they always compare. There's always someone in the house, like an older sister or an older brother, who has had a child before them easily. Their friends have conceived, and there's always that human tendency is to compare.
Right.
इसका हुआ तो मेरा क्यों नहीं हुआ? My cousin did IVF and it worked and I failed. We have to tell them that everyone's body is different. Everyone is made differently. And also at a more spiritual level, everyone comes with their own different destinies also.
Right.
The more you try to fight and compare, you are only hurting yourself and you keep going in that vicious cycle. You have to break that cycle. So just look at your, this thing, your case individually. You follow a healthy diet, healthy exercise, healthy lifestyle. Follow what the specialist has to say, and just go with the flow. That's it. Have faith in the process. Have faith in yourself, and go with the flow. And enjoy the journey also. Okay. Otherwise, if there is a set goal that you always have, and it sometimes I feel that it's in many patients like a tick mark. I got a baby, tick mark. Recently. We had a patient where, after delivering, she was like, oh, doc, I didn't think that it would be so tough. Now there's a baby here and now I'm freaking out. How do I take care of the baby? So that got to me that probably we need to address even parenthood, like what to expect when the baby is here, before or during the early stage of pregnancy.
Right.
Because it's not just having the baby, it's about that parenthood. It's a single continuum. Fertility, getting pregnant, through pregnancy, delivering, and then taking care of the baby.
Right.
So it's important to address those factors also.
So, sir, is IVF a very expensive procedure? Like for someone who's for a middle class person who's not having,
So I'll be honest. IVF, the cycle can cost anything on an average between 1.5 to 2 lakhs. Okay, there is no set price. Different centers have different quotations, but on an average, it will cost anything between 1.5 to 2 lakhs.
And the baby delivered through IVF procedure.
Yeah.
Has to be delivered in an IVF center, or it has to be in a normal.
They can go anywhere because not most of the IVF centers don't do obstetrics and deliveries because they are just standalone IVF centers. So many of these patients are referred by the fellow gynecologists. So when the patient conceives, some of the gynecologists, when the patient is when we first document the heartbeat, which is around 6 weeks time, we sometimes send the patients to their respective gynecologist, giving them the protocol what to follow till 3 months. I prefer taking care of them till the 3 months, till my drugs, what we call as is the luteal phase support. That support which lasts for the first 3 months, I see them through till that is over. And then once the 3 months, once we taper the IVF hormones that are giving support to the pregnancy, then the pregnancy care can be taken by the obstetrician who she was referred by initially.
Okay.
Yeah.
Is there this thing must be there, na? Like if IVF baby we are doing, we have to deliver it.
No, nothing like that.
Misconception.
No. The other, I would not say misconception. Most people, the mode of delivery, IVF हुआ तो cesarean ही करना पड़ेगा. Baby usually is born like vaginal delivery. So this is a bit contentious. There is it's not necessary that IVF babies have to be born by cesarean section. The patient, if there are no other factors, like there is no scar in the uterus, previous कोई surgeries नहीं हुए हैं, if the pregnancy is going in absolutely normal fashion, there is no danger to the baby or the mother, and if she goes into labor naturally, she can have a normal delivery. Most of us play it safe, and to be honest, even the patients play it safe. That after so many years, after so many attempts, we've had this baby. We want this baby out safely. Normal labor and normal delivery can be tricky sometimes because sometimes the babies don't take labor well.
Right.
So then most of the patients and most of the doctors, Give the option that, you know what, if you want, we can do an elective cesarean section, and that's also not wrong. There is a lot of debate in the Western world that we should stop giving the option of delivering a baby through elective cesarean section, because it's not a normal procedure, and there was a lot of disagreement to that. A woman has her own rights. I don't want to go through normal labor. I don't want to go through normal labor.
Yeah.
But IVF conceived pregnancy has to be delivered with cesarean section? No. They can have a normal delivery if there is no contraindication to normal delivery. Okay, so contraindication is a medical term where if she's otherwise healthy, if there is no other factors that can hinder a normal delivery, then she can opt for normal delivery.
Okay.
Yeah.
So, sir, do you have any story in mind which, specifically benefited a couple through IVF?
Yeah. So, one is very dear to my heart. This patient was my friend's relative, actually. And I had delivered my friend's baby. And after delivering the baby, my friend requested, look, my real sister is actually, struggling to, conceive and have a healthy child. She's had multiple miscarriages and they're traumatized and they always wanted to have a child. So can you see them? I met the couple. They both were around 34, 36 years at that time. They've had 3 miscarriages. They conceived naturally. Conception was fine. But in the first pregnancy, the baby was diagnosed with Down syndrome in the 3rd month, so they had to terminate. Second pregnancy, again around 2.5 months, she had a miscarriage. That baby, when you deliver the pregnancy tissue, you sometimes send it for testing to see whether it was genetically normal or not. That came out to be normal. Third pregnancy, again she conceived, and again in the 3rd month was found to be abnormal. Something what we call as Turner syndrome was detected in that baby, so she had to terminate that. They were just traumatized. They were like, I don't think we can ever have a healthy baby. And they were in tears. And that's the time I still remember. It was afternoon. I don't even practice in the afternoon. They live in town. So they came late and I said, you know what? No, I'll see you. When she was saying this story, she had tears. I also choked up a bit. And then I said, look, it's a lot that you've gone through. But there is a way to this. We can do IVF, create the embryos and test the embryos. So take a few cells out of the embryos, see which one are genetically normal and which ones are not. Because what was happening was she was having miscarriage because of abnormal embryos that were forming. So here she took time. She was like, you know what, I need some time to process this. After a good 2 to 3 months, they were ready. And we did their IVF. We got 6 embryos, tested all 6. 4 out of the 6 were abnormal. 2 were normal. So we discarded the 4. We inserted 1 and she had a healthy baby boy who's in fact now 2 years old. And it was an amazing journey. And we delivered that baby. And I still remember when that baby was out, there were just tears flowing, So it was a very, very heartwarming story of hope and how technology can help, even, obviously with someone who has had IVF is not just for those who don't conceive, but you can use this technology for those who have had abnormal babies also.
Right.
And give them hope, so that you select, you select the best embryo which is genetically normal, so that they don't have to go through that trauma of miscarriage or having an abnormal baby. So yeah.
So how much time does this IVF procedure take in total? Like if someone is planning to opt for it, how does it work?
So usually it takes up to so the preparatory phase from starting the injections to collecting the eggs, it takes about 12 days. Okay. Making the embryos is another 5 days. Okay. Now usually, as I said, that if the embryos are good and the patient's lining is good and her hormones are good, you can just place it back after when the embryos are formed, and another 14 days to check for pregnancy. So it spans across 1 month. Nowadays what we are doing is especially for those who have a very high response, who give us a lot of eggs, we don't insert the embryo in the same month. We make the embryos, we freeze them, and we let the patient get her a period after 10 days.
Okay.
Because these patients, who, especially those with PCOD, their response is so high that their hormones are very high, and if you insert an embryo and they get pregnant, there can be complications. And also now people are saying that you should in fact give a break to all patients and then prepare the lining in the next month. That's what we call as freeze all strategy. Freeze all the embryos, let the patients get one period so all the hormones are out of the system, and next month just build the lining. They say that the success rate is a bit higher. Okay. Because if you think logically, that month, all the hormones are out of the system, the body is reset, and now you just have to build the lining. So technically it can span up to 1 month to 2 months.
So how does this journey make you feel?
Yeah.
Like from the time of your internship, where you used to see 40-50 deliveries in a day, to now where you are actually doing it, for people through IVF, and helping them in solving infertility. How does it feel?
It feels amazing. I mean, there's a lot of hard work that has gone through. Sleepless nights, hard work, blood, sweat, and tears, and it's got me to where I am right now. It's, as I said, it's humbling as well, because I always feel that you can't let that pride get into your head.
Right.
Ultimately, many times you feel that there are so many things that are not in your control.
Right.
And that the only thing that is in your control is that your efforts. Sincerely do your efforts, be honest, be transparent.
Right.
Be transparent with the patient. Don't give inflated success rates. Don't give false hopes when there is actually no hope.
Right.
You have to be honest, you have to be transparent, and that will go a long way. And that's it. And in the end, I feel I'm proud of the medical community, where we've come. In India, we have amazing doctors, and we are doing some really good stuff. And I think what is needed is just our studies need to be published. And there's so much that India has to offer. Right. Many people come from, I've got so many patients who are coming from abroad. I get a lot of patients from Mauritius who are coming for their treatment here. In fact, just one of them, we had her day 5 embryo check right now. I had a patient from America. She was herself Caucasian, married to an Indian in America. That's another heartening story, where her one ovary was removed because of a big cyst, and then she was told that she'll probably not get pregnant. IVF was one way, and IVF is very expensive over there. So coming to your question, compared to the Western world, IVF is very reasonable in India.
Okay.
And that's why some people opt to come here, because you get the same quality
treatment.
There's no compromise on quality in every lab. Not any that, I'm not saying that only my lab. All labs are good, but at a much lesser rate.
Right.
So she opted to come here, and we had 2 embryos. We inserted one. She got pregnant. She also had a healthy baby a year ago. So it was another story.
So what is the message you would like to give to people who might be going through it?
Yeah.
And what? Just a simple message for them.
So the most simple message would be that don't give up. Okay. Don't put added pressure on yourself. Have faith in the doctor. Have faith in yourself, and just take one day at a time. Don't think about the result. What you have to do today is ye injection lena hai, ye time pe lena hai. Make sure that you are doing it on a daily basis, following the right the advice given by the doctor, and take it easy, and just be happy and be at peace with yourself. Ups and downs are normal. To feel, it's not always so that's why I didn't mention stay positive. It's not possible to stay positive always, because the hormones have the effect. accept that also. That's normal. It's normal to feel low some days. It's normal to feel fine some days.
Right.
Accept that. It's not abnormal. Once you accept that as a part of normal, you'll be fine.
Thank you so much for coming, doctor. It was really, I'm so happy talking to you.
Thank you.
And it was really very informative.
Thank
and
you.
I'm sure people are going to get a lot of information and insights out of this video.
Thank you.
Thank you so much for
Thank
coming.
you.